Examining the muscles of the hip and the thigh, we will begin with the rectus femoris muscle. This muscle is located on the anterior thigh, where it crosses both the hip joint and the knee joint. It flexes the thigh at the hip joint if the knee is fixed by other muscles, or it extends the leg at the knee joint if the hip is fixed by other muscles. The term fixed implies that the joint is held stable and temporarily immobilized. The gluteus maximus is located on the posterior hip, crossing the hip joint. It is one of the most powerful of the body's muscles because it stabilizes the hip. Its actions on the hip include extending and abducting the thigh at the hip joint. The sartorius on the anterior hip and thigh crosses both the hip and the knee joints. It functions to flex and abduct the thigh at the hip, or it extends the leg at the knee joint if the hip is fixed. On the posterior thigh is the biceps femoris muscle. This muscle crosses the hip joint and the knee joint. When it contracts, it extends the thigh at the hip, or it flexes the leg at the knee joint if the hip happens to be fixed. Anteriorly, the strap-like sartorius muscle that crosses the thigh and the vertical rectus femoris muscles can be found. Posteriorly, the gluteus maximus and biceps femoris muscles are visible. The muscles of the leg include the tibialis anterior and the gastrocnemius muscles. The tibialis anterior, located on the anterior leg, crosses the ankle joint. Contraction of this muscle dorsiflexes the foot during walking and running. Posteriorly, the gastrocnemius muscle crosses the posterior side of the ankle joint. Its action includes plantar flexing the foot during walking and running. Returning to figure 11.5, the tibialis anterior can be seen in the lower portion of the diagram. The gastrocnemius muscle, which has been dissected away to show deeper muscles, is a two-piece muscle on the posterior leg that crosses the ankle joint to connect to the calcaneus of the tarsal bones.